Hello, my name is Ryan Wicks. I'm a UAS pilot, technician, and data analyst. And in this video, I want to share with you this presentation that I put together called Thinking Critically About COVID-19, Insights from Basic Models, or at least a summary of the full presentation that I do in my other three-part series, video series. As I discussed in my first video, like many of you, I've been learning to survive in a pandemic, and I want to be able to share some of those resources that I've found that were helpful for me, as well as talk about, the modeling that I've done to, do risk models as well as epidemiological models that I've kind of, played around with. So I've done, I've done analytical models virtually my whole life as part of my academic and professional work. I'm not an epidemiologist, however, working with other analytical models in the past has given me some insight on, such as, I've done population modeling in a very limited capacity, simply in an academic setting has given me insight to understand the papers and current research in scientific literature that's out there about epidemiology in general in this disease. So I wanted to share that. And there's a lot that I cover in those other videos, but I wanted to give a high-level summary of what I cover in those videos because there was a lot, and so I'm trying to be concise in this video, just give a summary. So I break those videos down to three parts. One is just talking about general theory of epidemiology and looking at case studies for COVID-19 in different areas, as well as how that science can inform and impact public health policies, and then how those public health policies impact the projections and forecasts for how COVID-19 and other diseases spread. But specifically focusing on COVID-19, and then finally sharing tools that I have in references and resources that have been helpful for me, both in putting this presentation together, but also, figuring out how to survive in a pandemic, right? And how to protect myself and protect others. So when I talk about the models, I just essentially say, all right, well, if you have a particular region and you have case data from the last 14 days that you get from Johns Hopkins University or from some other source like the CDC, World Health Organization, and you say, all right, given a particular region, if I look at the case data, confirmed cases in the last 14 days, how do I take that and then understand the risk to myself and my risk to others? And then I talk about how I put this table together, where on the leftmost column, you have the interactions that you and your family or your virtual family or your pod of individuals that you interact closely with inside your own household or within a couple households, or whatever that particular case is, and just talk about how then, given the caseload in the last 14 days, what kind of risk you're inheriting based on those behavior patterns, as well as the amount of risk that you're projecting back on the public for spreading the disease further that I cover here in the rightmost column. And so I talk about how I model that, as well as the implications of this. And I do talk about how these different risks, these risk patterns, these behavior patterns, and different policies can shift, how our aggregate behavior patterns can shift the replication number of the disease. That is, essentially how well the disease spreads. And I talk about how the disease has spread in specifically Massachusetts and Suffolk County over the course of the pandemic. And I have some commentary on that. And then I do talk about the more general models that exist for once you parameterize the disease and how to forecast it and how to model it. And I talk about the SIR model as a baseline for other models that are more refined. And then I talk about, and so here I do some basic modeling about saying, all right, if I just take a logistic model for cases, both confirmed and unconfirmed over the course of the pandemic, how can we expect them to spread? And I talk about how, our behaviors which shift the replication number, how sensitive the total caseload, as well as the steepness of how quickly the cases occur and how many people sick at once is dependent upon those behavioral shifts, which are informed just by individuals making personal choices as well as policies to help evoke those kinds of behaviors, right? And keeping people informed. And then I do talk about those policies or habits and how those specific policies or behavioral shifts specifically how they affect specific parameters and how those parameters in turn affect the model. So I go through virtually every single, policy or, piece of advice you might have heard, maybe even some you hadn't. And I talk about, at least from a mathematical standpoint, how those affect the spread of the disease. And then finally, I do share the tools and resources that I found that are quite useful. So definitely my references that I used, as well as some of the tools that I developed. Even though they're quite simple, they can be, give you some basic insights. Certainly not as robust as something you'd want to make, official policy decisions on. But I do talk about specifically the resources for how to get support. If you have COVID-19, a family member has COVID-19, or you're just trying to keep your family and friends safe, or yourself safe, or your community safe. So I talk about testing, traveling, quarantining, socializing, and general precautions, and how to get up-to-date information, and how to access expert opinions, and reference the actual experts that are doing the modeling for professional work. And this includes like public service announcements and things like that, right? For best practices for keeping people, yourself, and others safe. So I talk about, when to get testing, where to get testing, where you can get, testing locations, what kind of tests are out there. I touch on that, as well as provide resources for that. Talk about if you're traveling, how to address travel precautions, travel policies, best practices, as well as how to actually get informed about what are current caseloads in areas you might be traveling to or from to protect others where you're going or where you're coming from or where you're coming back to. And I talk about where you can get that data on, the international level, the national level, the state level, the county level, and even the town level in some cases. Right, and you can get it from like the CDC, Johns Hopkins University, the World Health Organization, but there's a few sources that have really tried to aggregate and integrate all that data together in a palatable way. Right, so this is just an example of one report. So in the case of Suffolk, Massachusetts, where you can get just from one source, from Johns Hopkins, for instance, that they've made that available to the public. And then also I talk about quarantining, when to quarantine. If you've had contact with someone with COVID-19 in the last 14 days or suspected contact. Or contact with someone who's suspected to have had COVID-19. And I talk a lot more about this, but I talk about when to quarantine and then what to do in quarantine for yourself, to protecting others, where to get information, more specific information on this, and talk about contact tracing, what that means, and then how to participate to keep others safe. And what to expect, right? If you're contacted by someone for contact tracing. And again, you can find more information on the websites that I specifically point to that for the programs that are actually administering the contact tracing. And then quarantining, when to end the quarantine, right? And how that varies depending whether or not what kind of testing you can get and when. And what's safe, but usually just depends on you're talking to your doctor, but these are the general guidelines by the state and recommendations for the state, both requirements and the recommendations. And I also talk about socializing and general precautions. I don't really talk about mental health. I touch on it, but I don't have specific resources for saying like, here's where, you can get resources on, mental health effects of isolation and quarantining. But I do, I talk on it a little bit. And then I also, I talk about here for socializing general precautions. I talk about the general precautions that, if you're trying to protect your friends and family, as well as the community, what are prudent measures to do that? And, specific nuances in the way people, if you're forming a pod or a social group, that's your support and the people, the few people interacting with directly, whether it be family members or a friend or two, how you can do that as safely as possible and what the trade-off and risks and benefits are. And I talk about the mathematics that on a very cursory level. But certainly, that's something I talk about in my first video in more detail. And then as well as how to access more information, where you can access information from experts, from the government, from some nonprofits, from research groups, from how you can access the raw data, Here for these slides, I'm just showing 6 of them, but I think I have dozens upon dozens of sources that you can check and really get a robust, holistic view of the current best knowledge and understanding of COVID-19 from an epidemiological standpoint, from a policy standpoint, from from a symptoms standpoint, from a medical perspective. I've tried to make many different types of resources available as well. So, and that is all I have for the summary. Be well.